Have you ever experienced headache one day and then all of a suddenly you go to the pharmacy, buy acetaminophen or paracetamol tablets, you swallow, and within 5 to 10 minutes the headache actually disappears? That is basically what pharmacology is here to explain to you, so that you can understand how this medicine is able to move around your body, get into those, identify where the headache is, and it is able to alleviate the pain. That is why paracetamol is actually a very good analgesic for those moderate or mild pain or headache. Yes, in today's video, we are going to be learning about pharmacology, an overview or a brief introduction to pharmacology. When we talk about pharmacology, in a very simple definition, pharmacology is actually the study of how drugs interact with the human body. It is as simple as that. You're going to see very many definitions in different textbooks, in different sources, but the simplest way is just how chemicals or drugs interact with the human body. And then what is a drug, for example? A drug is a chemical molecule or any substance that can cause a physiological change in the body once it is introduced into the human body. I hope that is well and clear. Yes. Now, in this introduction to pharmacology, we are going to look at majorly the two pillars of pharmacology, which is pharmacokinetic and pharmacodynamics. And then before I go any further, pharmacology actually comes from two Greek words, pharmakon and ecology. Pharmakon means drugs, and then ecology means study or knowledge. So pharmacology is basically just drug knowledge, or the study of what? Drugs. So, just like I told you, there are two major pillars of pharmacology, and that is pharmacokinetics and pharmacodynamics. Yeah, now that I'm confident that you know what pharmacology is, and you basically understand what a drug is, let's dive much into the two major pillars of pharmacology. Now, pharmacology is divided into basically two parts, which is the pharmacokinetics and pharmacodynamics. And these two are very important, because once you understand the pharmacokinetics, which is basically how the drug moves around the body from the time you swallow it until it gets out of the body. And then pharmacodynamics just look at the drug-receptor interaction majorly. And of course, it also involves other things like the potency, things to do with the effective dose and the lethal doses. So you realize that all drugs actually follow the same principles, and that is why it is very, very easy to actually understand pharmacology. Now, let's look at the drug's journey in our body. Medicines move through several pathways once it is introduced into the body. When you swallow paracetamol right now, what happens is that it enters into the gastrointestinal system. It goes into your stomach, into the duodenum, and it is liberated. The liberation actually means the drug is going to undergo disintegration, and after disintegration it undergoes dissolution into the intestinal fluid, and then this drug is ready for absorption. Of course, there are very many factors that can affect absorption, and we are going to look at those factors and the mechanisms of absorption in our next class. You're going to realize that the molecular size of the drug, the lipophilicity, or the Yes, lipophilicity, something to do with the lipid solubility of this drug, is very important during the absorption. And then a drug can undergo absorption by just a simple diffusion or a facilitated diffusion or even active transport, depending on the type of drug molecule. And this drug gets absorbed and then goes into what? Into the systemic circulation. So basically, in simple term, absorption is the movement of a drug molecule from the site of administration into the systemic circulation or into the bloodstream. Once this drug is made available into the bloodstream, then it can start undergoing what they call distribution. What is distribution? It is just the journey of the drug within the body. That journey that the drug takes once it enters into the systemic circulation. It can be a reversible journey. A drug can move from the bloodstream into the tissues where it interacts with receptors, and then it comes back into the into the bloodstream or the systemic circulation. It is very important to understand this because it enables us to know things like the plasma protein binding of these drugs, how it affects the drug distribution. And then also you see lipophilic drugs, for example, are highly distributed. And then that brings us to a point called volume of distribution, that a medicine that only distributes within the blood actually have a smaller volume of distribution. Why? Because it is only distributed within the blood and does not get to reach other tissues. Now, for a drug to have a larger volume of distribution, that means it is able to leave the bloodstream and get into tissues. It gets into the extravascular compartments that can be within the interstitium or even the intracellular. Some drugs are able to enter into the into the cells, and you find that these drugs are actually having a very large volume of distribution, while those that remain in the bloodstream actually have a very smaller volume of distribution. So what is distribution? Distribution is the movement of a drug molecule from the systemic circulation into the various compartments within the body. It is actually a reversible journey because it involves drugs moving into the tissues and then back into the circulation. It is a very important part, and distribution is affected by several factors, and some of these factors are things to do with the lipophilicity of the drug. It's very important in affecting distribution of this molecule, because a drug that is highly lipophilic ends up getting distributed to several areas, and we shall dig much into this distribution also in another class. So make sure to check more videos on this channel to make sure you understand all these concepts one by one. Absorption is going to be in a different video. Distribution will also be covered in its own into detail, and then metabolism and excretion will also be covered in another class. So let's look at metabolism. Metabolism, basically, in simple terms, is just a biotransformation. It involves adding hydrophilic groups to the drug molecule to make it more water soluble. And what is the aim of this? It is to make the drug easily and very easy to be washed out of the body system. It involves phase 1 and phase 2 metabolism. Phase 1 involves just adding small hydrophilic chemical groups like hydroxyl groups, hydroxylation, things like oxidation. Those are the major reactions that happens in phase 1 metabolism. And then there is also phase 2 metabolism that involves adding large hydrophilic groups like a glucuronide, for example. And this is very important in excretion of this medicine. You find that a drug, once it is made very water soluble, it cannot cross the phospholipid bilayer that makes up the membranes, and therefore this drug cannot be reabsorbed in the kidneys. Therefore, these drugs in most cases are excreted either in urine or in the fecal matter or in any other site of excretion. And then excretion will be the last part in pharmacokinetics. You find that the drug that is now biotransformed is washed out of the system because they can no longer be absorbed, so it is washed either in the urine or in the feces. And then also some drugs are actually eliminated unchanged. An example can be the aminoglycosides, because they are already highly hydrophilic, and you find that most of these drugs are just distributed within the blood system, the systemic circulation. They have a very small volume of distribution, so once they reach the kidney, they can be washed out due to the nature, the structural nature of these drugs. And then the second thing, what we are going to look at is the pharmacodynamics, or how the drug is able to heal. How is captopril, for example, able to lower the blood pressure? And the drug mechanism of actions basically mimic our physiology. We are looking at either potentiating the physiology or antagonizing the physiological pathways, and this is very important. That's why it is very good for you to understand physiology before you can be very good at pharmacology, and physiology is actually a basis for understanding pharmacology. So just like most medicines act like they bind to receptors, like you see the key fits perfectly into the lock. So just like you see this key is able to open only one padlock. It is made in such a way that it doesn't open any other padlock. So without that padlock, this key is actually useless, and without this key, that padlock becomes useless. So medicines are made in such a way that they can only fit to a particular receptor, and it is able to, bind to that receptor and cause an effect. This effect can either be a therapeutic effect that is responsible for alleviating a particular disease condition, or sometimes too much activation of a particular receptor can actually lead to what they call a toxic effect of the drug, or a side effect. That is when it is binding to other receptors other than the one that we are actually targeting. And that is very important also in drug selectivity. That is why medicinal molecule actually undergo a lot of modifications to ensure this structure is very selective and it is very complementary to only a specific receptors. And that is why antibiotics are able to target specific receptors in the bacteria that are actually not present in our body. There are some receptors that are only present in the prokaryotic or the prokaryotes, but are not available in the eukaryotes. And yeah, that's how medicines are made. And then drugs can either be agonist or antagonist, or even inverse agonist. So the agonist just activate, it's like they turn on. When a key is pushed into the padlock, it opens the padlock. Yes, just that's how those medicines work. For example, looking at salbutamol, when a patient swallows, an asthmatic patient swallows salbutamol, it mimics the effect of adrenaline and it opens the airways. It is a beta-2 agonist. It is able to, open the airways, and then the asthmatic patient can actually breathe very well. And then antagonists are these drugs that it's like inserting a wrong key into the padlock and breaking that key inside the padlock, such that another padlock, the right key cannot actually, enter and open that padlock. So the antagonists are blocking the right molecule from activating that receptors, An example in that case is a beta blocker. And these beta blockers, once they bind, for example, to beta receptors in the heart, they prevent the epinephrine and noradrenaline from, activating these receptors, and that is how they are able to lower what? The blood pressures, because they lower the heart rate. Once you bind there, you prevent the sympathetic, responses. The other thing is looking at safety, or what they call the therapeutic index. In therapeutic index, we're actually looking at the toxic dose versus the effective dose. You find that we are looking at the dose of a drug that is able to, bring a particular therapeutic effect, and the dose that is able to cause a toxic effect. So therapeutic index is just the ratio of therapeutic dose, the ratio of toxic dose to the effective dose. And then the safety issues now come in dosing of this medicine. For example, some medicines, you find that the difference or the range between the effective and toxic dose are actually very close. An example in this case is warfarin, that you need to monitor what they call the international normalized ratio, or the INR, because a very slight increase in dose of the drug can actually result in very severe bleeding. And that is why the monitoring of these medicines become very important, because the effective dose, or the therapeutic dose, and toxic dose are very close, and an understanding of this knowledge enables you to, take cautions when you're treating patients who need or may benefit from what? From the use of warfarin. So let's look at some of the few terms that are used in drugs or medicines dosing. The term bioavailability. Bioavailability is that fraction of administered drug that is able to reach the systemic circulation or the bloodstream intact or unchanged. The word unchanged or intact is a key word there. It should not be chemically biotransformed. So an IV or intravenously administered drug typically they have 100% bioavailability, because the entire dose is introduced intravenously into the systemic circulation or into the bloodstream. That is why we consider it an absolute, or the bioavailability, it's 100%, and it is introduced directly into the bloodstream. Then for other routes of administration, the bioavailability cannot be 100%. Why? Because these drugs have to undergo absorption, and in the process, some drugs are actually not able to reach the systemic circulation. For example, for an orally administered drug, you will find that some of these medicines, once you swallow it, get into the portal circulation, and it can undergo what they call a fast pass metabolism. And that fast pass effect is going to modify these drugs. It is going to, change the structure or the molecular. It's going to biotransform this molecule, add groups to the structure of this drug, and then the bioavailability will be greatly reduced. And then also the absorption of this molecule. Some drug molecules may not be actually absorbed. That is why an orally administered drug cannot be 100% bioavailable. And then things like the enzymes within the stomach may also, break down some of these molecules, and some drugs actually can escape together with the food that is eaten into the fecal matter, and it end up not being absorbed. An example in case is albendazole. When you swallow albendazole, actually has a very, very little bioavailability, especially when taken on empty stomach. That is why when we advise patients that are having, for example, GIT worm infestation, we always advise them as pharmacists to, take the medicines in the morning when they have not yet eaten anything, because we don't want albendazole to be absorbed such that it's highly concentrated in the GIT and it can kill the worms that are within the GIT. And then the other key term is half-life. Half-life is the time it takes for the body to clear 50% or half of the drug that has been administered. And several drugs have different half-lives. Of course, a lot of things can affect also half-life. Things like, for example, looking at very highly lipophilic drug, they can have longer half-lives. Why? Because they are distributed very widely, and then it is hard to eliminate them because of that reabsorption capacity of these drugs. And then the other thing is clearance. It is just the speed at which the body removes the drug from the system. So you find that some drugs, especially these drugs that do not even require, biotransformation, highly hydrophilic drugs are easily cleared of the system. An example is gentamicin, which is an aminoglycoside. Gentamicin actually takes a very short time within the system, but it has an effect. The effect lasts a longer time. Yes. So those are some of the factors that can affect clearance. And then a drug like diazepam that is highly lipophilic, they are hard to be cleared from the system because they undergo a lot of they have a very large volume of distribution. They get into the CNS, they get into the adipose tissues, they undergoes distribution, then afterwards it is redistributed, and you find that it is really very complex. Yeah. So basically that is that.